today, and to hear from some of the speakers that I'll be introducing as we go along. And you can just see the panelist name up there on the screen. I just want to I am zooming in from Adelaide, South Australia, and I just want to pay my respects to the Indigenous people of Australia, who are the traditional custodians of the land here, and I pay my respects to elders past, present, and emerging, and I pay my respects to any Indigenous people on the call today. So we've got the next hour together. So looking forward to having people be able to, listen to the presentations. If you do want to, add some comments into the chat, we will be having 10 minutes at the close to have some question and discussion time, but do feel free to put those questions into the chat if you would like to. And if you've got any questions or feedback, you can, the email for eBase is on the screen there, contact@ebaseafrica.org. So send through any of those questions, and there will be a recording, so I guess that will be available afterwards as well. Just if you are on social media and you like to post, you can, obviously there's some hashtags there, so feel free to jump on and make some comments if you want to during the webinar as well. So this is webinar 1 of this Bridging Evidence and Action, a webinar series on synthesis and knowledge mobilisation. And I think it's a really exciting that eBase is hosting this 4-part webinar series, and to really, I guess, deep dive into evidence synthesis and knowledge mobilisation, which is a real passion of mine. So today's webinar is all focused, though, on audit and feedback, and talking about the different sectors that this audit and feedback has been used. And so I think this is a really exciting time, and I just want to share this picture that's on the screen, which is at JBI, we often talk about having a ripple effect on those around you. So JBI is a global healthcare evidence-based organisation, and we're all about getting evidence into clinical or real-world settings. And our logo, you can see there in the left-hand corner, is a pebble into a water to create ripples. So we are all around impact on those around us. And I guess our story at JBI and our relationship with eBase was with Dr. Patrick Ockwin, who I know many of you will know. And I met Patrick, I think it would be now 10 years ago, when he came to Adelaide, to JBI, to do our evidence implementation training program. And it was really wonderful to meet him at that time. So I'm looking forward to the ripples that JBI has had, and then the work that obviously is continuing on at eBase today is really exciting, and I'm looking forward to hearing more about it. I'm just going to set a bit of the scene of how JBI views and how we use audit and feedback in our practice, and then I'm going to hand over to our 4 panellists. So I'm just going to just share with this, and if you have been involved with eBase and know a little bit about JBI, you will have seen this colourful model on the right-hand side, which is the JBI's conceptual model of evidence-based healthcare, and particularly where the audit and feedback part comes into it is sitting in this orange section of the conceptual model. and that's around the evidence implementation. So the JBI approach to evidence implementation is firmly grounded in the audit, feedback, and re-audit process, and takes very much a structured approach. And you can see on that left-hand side, we have a 7-phase approach to how we go about implementing evidence using audit and feedback. And that might be something that you have seen or that has been talked about at eBase in the past. And so if that's something you're interested in learning more about, talk to Dr. Patrick about that. I'm sure he'll be keen to be involved. He'll get you involved. So I'm sure that you all would, be aware of the stages of audit and feedback, but I think it's just worth highlighting. It's a cyclical process that happens where people go about deciding and selecting a topic to focus on. They plan that in detail, and then they will take a baseline measure. So they'll monitor what's actually happening right at this stage now. What's our baseline measure? When they have a look at that baseline measure, it's then really important to feed that data back to the people that you're working with, and to then take action to improve and implement strategies. And then importantly, there needs to be a re-audit whether it's 3 months or 6 months or a year later, and there needs to be ongoing action. It's not enough just to say, well, now this is finished and that's the end of it. And so this, I think, will be something that comes through, I'm sure, from our speakers. So at JBI, we always are putting first and foremost, what is the evidence that we want to be, what's the evidence that's going to inform our audit and feedback? What's the evidence that we want to be implementing? And I'm sure that this will come out in the case studies as well that we're going to hear. Our evidence, it's also then thinking about what are the indicators, or what are we actually going to use to measure this evidence in practice, and we call them audit criteria or quality indicators. And so that's a really important part of thinking through as well. How are we actually going to measure in this audit and feedback cycle? And that's a really important part of it as well. Now, if you want to read a little bit more about the effectiveness of audit and feedback, there is a lot of feedback, and it's just been a recently updated Cochrane systematic review. It's freely available in the Cochrane Library. If you're interested, you can find more information around that. But audit and feedback is effective, and these different factors up on the board, but especially when it's an area that's a high priority issue, where there is substantial room for improvement. If feedback's delivered by a respected peer, that's seen as being more effective. If it was provided more than once, if it was delivered in both a verbal or a written format, and if it featured an action plan with advice for improvement. So without any further ado, I want to hand over to our panelists now. So I will stop my sharing, and I'm going to hand over to Thelma Ake, who is a health research fellow at eBase Africa, and currently doing her PhD in public health and hygiene. So over to you, Thelma.
Thank you very much, Alexia. for joining us on this webinar series. As Alexa said, I am Akato Maeni, a health researcher at eBase Africa, and I'll be presenting on audit and feedback approach as a powerful tool for healthcare improvement. Next. So my outline will run from the introduction, and then we'll look at 3 case studies on how we have implemented the audit and feedback approach in Cameroon, to be precise. We'll look at the cross-cutting insights and then future directions. Next slide. So audit and feedback, as Alexa earlier said, it's an evidence-based implementation strategy, which is how to improve healthcare practices and outcome. We are out to look at the current practices against the established evidence-based standards. First, we identify the problem, that is, we recognize an area for improvement in clinical practice healthcare. We establish evidence-based criteria, that is, we develop criteria based on either systematic reviews or best evidence to guide the audits. Then we do a baseline audit measuring the current compliance rates against the established criteria. Then we provide feedback to stakeholders on the baseline audits. We develop interventions based on the compliance rate, and then we do a follow-up audit to assess the effectiveness of the different interventions. So this is a circular process from audit to feedback to action, and then we audit it. Next. Audit and feedback is a very important process as it helps us to identify gaps in practice. It also motivates behavioral change. It supports data-driven decision-making. It enhances accountability and motivation. It also encourages community engagement and trust, promotes resilience and adaptation. It facilitates targeted interventions to improve specific areas. And then it is relatively low cost and adaptable to various settings. Next slide. Moving on to our very first case study, we want to look at how audit and feedback was able to drive down malaria cases in Cameroon, precisely in the Bali Health District. So Cameroon has a high burden of malaria, and with deaths often resulting from poorly managed uncomplicated cases. We also have aspects of misdiagnosis, over-reliance on the rapid diagnostic tests, lack of evidence-based practice in managing uncomplicated malaria, especially among children under 5. 3 complicated malaria cases that were recorded in the Bali Health District in 2016. And so we decided to do an evidence implementation project using the JBI audit and feedback approach. It was performed in 3 health centers, and we had 5 evidence-informed criteria that we used. We engaged stakeholders and we were able to analyze barriers using the JBI grid model. Next slide, please. So this slide gives us a graphical presentation of our results at baseline and at end line. Below, you see the different criteria that we used for the audit activity. So for the base audit, it revealed that there were varying compliances with best practices. All the criteria scored below 60%, and criteria 5 scored 0. This was due to the lack of availability of the drug use in these criteria. Criteria 6 also happened to score very poorly, which indicated that clinicians rarely test for mixed infections. And this is due to the ease of use of the rapid diagnostic test and the fact that this rapid diagnostic test will only detect the Plasmodium falciparum. So we went ahead and developed implementation strategies to help mitigate this aspect of compliance. So a protocol for the management of uncomplicated malaria for children under 5 was developed and made available to these clinicians. Text messages were also used for dissemination of evidence to the clinicians. We also focused on clinician coaching through discussions and the use of graphics. So after this implementation and monitoring for a period of time, we did a follow-up audit. And from the results, we realized that there was an improvement in 5 out of the 6 criteria. There was no change in one of the criteria, that is criteria 5, still the same reasons. And however, when individual units were analyzed, there was a noticeable difference between the trends of compliance at baseline and in progress over time after the intervention. So this showed us that audit and feedback empowered healthcare workers to make data-driven decisions. Patient outcomes improved significantly. There was also regular feedback from local leadership, and it sustained these improvements despite the conflicts we had in this region. There was also adherence to evidence-based guidelines for both diagnosis and treatment of malaria, and healthcare workers were more motivated to improve performance. So this served as a powerful tool for resource-limited settings and also enhanced both efficiency and patient safety. Next slide. Our next case study was we used audit and feedback approach to boost penta vaccine uptake in Cameroon. So it was realized in the Valley Health District that there was low penta vaccine uptake, and this was attributed to poor communication between the healthcare providers and the caregivers. There was hesitancy from the caregivers, and the community did not trust the immunization program. So we used the JBI audit and feedback approach, and it was a participatory one. That is, we involve healthcare workers, community leaders, and the caregivers. We conducted this audit on communication practices during infant welfare clinic, and we also identified the barriers to penta vaccine uptake. Next slide. Next. So here we have the graphical presentation of the results we had at the baseline audit and at the feedback. Please, previous slide. So for the baseline audit, all the criteria scored below 40%, and criteria 6 and 7 scored 0. For criteria 8 and 10, they scored very poorly, and it indicated that the healthcare workers, they give out inadequate information, and no updated communication materials were available. Strategies used for, we implemented strategies or interventions that will help in the compliance with for the audit. So these interventions included group discussions with the community. We developed decision-making model for the intervention. We delivered evidence summaries. We sent SMS reminders to the caregivers. We also trained healthcare workers on communication and listening skills. We addressed rumors, misconceptions, and fears publicly. So after this intervention, we did a follow-up audit. And from this, we realized that there was substantial improvement in 9 out of the 10 criteria. There was no change in criteria 7. But also when this data was analyzed for individual units, there was a noticeable difference in compliance rates for improvement during the follow-up audit. Next slide. So immunization coverage increased from 65% to 85%, sorry. And this 20% increase was very significant, and it highlighted the power of participatory dialogue. It showed the importance of real-time community-informed feedback and the importance of also including communication as a core component for health interventions. We had limitations such as cultural barriers, and resistance to change was also observed due to deeply ingrained beliefs and misinformation. But then Audit and Feedback was able to address communication barriers and improve vaccine uptake, and also it showed that it was replicable for other regions. Next slide. Looking at our third case study on improving healthcare worker resilience during the COVID-19 in Cameroon, we also use the audit and feedback approach, as we realized that healthcare workers faced a lot of immense challenges during the COVID-19 pandemic. So we assessed their compliance with evidence-based practices, and we developed and implemented targeted strategies for improvement. Next slide. Here we have the results for the baseline and the follow-up audit. We realized that at baseline, which is the black bars, all indicators showed poor compliance with most of the criteria that were used. And then after doing interventions, we had a follow-up assessment, and it showed significant improvement. That is, majority of the criteria reached up to 100%. However, health support remains unchanged, highlighting the ongoing gap in addressing psychosocial well-being. Next slide. So we had an increased compliance with resilience support practices. We had improved healthcare performance, and patient outcomes were also got better during the pandemic period. So Audit and Feedback had the ability to effectively translate research into practice and also help frontline workers to adapt quickly. Next slide. Looking at the cross-cutting insights for the case studies that we have, Audit and Feedback is effective across various health challenges. It empowers healthcare workers. The success of this process is strongly influenced by local leaders and active stakeholder engagement. Also, it facilitates translation of research evidence into practice, thereby improving patient outcome, and it results in significant improvements in compliance with evidence-based guidelines. Then also interventions are tailored based on the audit findings, hence it's crucial for addressing specific barriers and challenges. Next slide. Moving forward, we are looking at scaling up audit and feedback interventions to address other healthcare priorities. We are looking at developing strategies for audit and feedback. We're looking at incorporating technology in community engagement to address cultural barriers and advocating for policies. We also want to strengthen cross-border collaboration and learning, and also conduct further research to identify the most effective audit and feedback strategies for different contexts and relations. Just a technical exercise, and when done inclusively, it becomes a tool for behavior change, trust building, community empowerment, and it also improves patient outcomes. Next slide. Thank you for your keen attention. I look forward to having your questions.
Right. Thank you so much, Thelma, for that great presentation. And we will save up some questions and time for at the end when we've heard from the other presenters. So thank you very much for that. Our next presenter is Ambang Tatian, and she's a manager or works within eBase Africa in the education sector. So I'll just hand over to you, Ambang.
Thank you. Thank you, Alexia. So we are building on We are building on what Thelma has just presented in the health sector, and we decided to adapt this to the education sector. And we are going to be looking at bridging the gap on contextualized evidence dissemination through pedagogic audit and feedback. I am presenting on behalf of Rubebe Bambe, the program manager for education. Slide, please. So looking at the big picture of sub-Saharan Africa, we notice that there is the learning crisis, which has limited the access to education, and this leads to low achievement and engagement, which is worsened by systemic inequalities. And this is because teachers, there is actually the resources and the evidence, but teachers have insufficient training and resources that hinder them from the adaptation of evidence-based practice in their classrooms. So we are looking at ways in which we can have actionable strategies so that teachers can acquire context-specific tools and to be able to help them to implement research-based teaching methods in their classroom based on their context. And for us to be able to understand this, we looked at how we can be able to bridge the gap between the evidence and the problem that they're facing in their classrooms. So we came up with this idea of the pedagogic adapted from the JBI, as we have heard from the previous presenter, of the audit and feedback, so that which is a transformative approach that enables continuous reflection on teaching practices and facilitates evidence integration into the everyday classroom activities. And audit and feedback, just building on it, we have heard that it is very actionable. So in education, we are looking at how we can be able to take actionable steps that build criteria and methodology that empowers teachers to be able to implement evidence-based strategies tailored to their various specific contexts in their various classrooms. And we want to emphasize this by the cycle of feedback that be able to allow these educators refine their practices incrementally and also lead to teaching improvements over time. And this is very effective. This is a very effective application because it is guided by the pedagogic audit and feedback, and it is very practical that teachers can be able to adapt it in their various unique environments. Slide, please. Slide, please. Just like I mentioned, that we built this approach. Just like I mentioned that this approach was adapted from the health sector, from the JBI approach, and we are incorporating it so that we can see behavior change in teachers. Slide, please. So as we adapted it, we followed the various steps of audit and feedback. That is, we audit the teachers, we build criteria that we call the audit. We bring criteria from evidence-based. We take these big evidence, we break them down into various criteria that we call the audit. We go to that, it's just answered by yes and no. And then we go now to the classes, we audit the teachers, we analyze this, we go for feedback sessions, we identify the barriers that the teachers are facing. Together we come up with strategies to be able to, with the teachers to be able to address these barriers that the teachers are facing in their classes. Slide, please. So as part of the pilot program, we piloted this in 4 countries. with 4 fellows from in each of these countries. And one of the slides and one of the strands that we in the pilot, we prioritize effective feedback to students. And there were 80 teachers from 40 schools in these 4 countries. That's 10 schools per country and 20 teachers per country. And then for the evidence-based criteria, we developed 49 evidence-based criteria, and we did quarterly feedback audit and also feedback sessions. And before we did that, we did capacity buildings for the fellows. And these fellows now were able to train the teachers on audit and feedback. Slide, please. So here we are looking at some of the audit criteria that was developed. For example, we have built on people's previous knowledge, prior knowledge and experience. That is, we take these criteria from evidence and then we look at it and then we take them into simple steps in and looking at what the teacher is doing in class and just tick if it's yes or no or yes or no. And then after that, just like we explained before, we look at, we analyze what they have been doing. And then we have a feedback session with them. We discuss the various barriers in which they are facing. And then together we come up with strategies and then we do the audit again. And from there, from this pilot project, slide please. From this pilot project, we discovered that at the baseline, there was 37% compliance, and at midline, the teachers moved to 68%, and at end line, the teachers moved to 77%. And at the end of this pilot phase, we discovered that there was increased compliance with evidence-based practices, and there was significant rise in teachers' adherence to evidence-based strategies. And this indicated indicated a positive impact on teachers' methods. Also, there was also enhancement in verbal feedback. Teachers were able to improve on verbal feedback processes for their children, leading to rich interactive sessions with their children and more supportive environment and more supportive learning environment. We also saw that there was practical guidance and support offered, as the model provided teachers with specific actionable guidance, boosting their confidence in applying evidence-based strategies. Also, there was successful evidence implementation, as teachers reported by teachers that the abstract and theoretical evidence became practical and actionable, resulting in higher student engagement and improve academic outcomes. Slide, please. So some of the barriers are the barriers that is listed at the side. On the left side, we have large classrooms, we have lengthy curriculum, and then together we came up with strategies on how we can be able to identify some of these barriers. For example, for large classrooms, we have group work and collaborative learning, and also mixed ability, grouping, and differentiation. Then we have lengthy curriculum, which is focused on core competencies and the others. Slide, please. So after successful implementation of the audit and feedback piloting in these 4 countries, we have been using audit and feedback in other projects that at eBase in education. This one is the audit and feedback in Limbe for metacognition and self-regulatory learning, in which the number of teachers that participated were 10, and the number of students were 359. And we had 58 audit criteria. And the number of audit rounds, we did 3 audit rounds. At the baseline, the teachers' compliance level to evidence-based practice was 52%. And at midline, increased to 80%. And at end line, we saw that it further increased again to 95%. And slide, please. In a nutshell, we are saying that audit and feedback is actually working as it has worked in the health sector. It's also working in the education sector because it is a shift from merely providing instructional tools to promoting active engagement and it is now shifting to real-time application of evidence within the classroom. Also, the feedback loops establish models that facilitates continuous learning and teaching enhancement process and dynamic responsive from the educator's needs. And the audit and feedback is a promising approach because this approach is actually done by, it's actually, this approach is a promising approach because it is a teacher professional development approach, and also it helps to be able to change the teacher's behavior, and also it helps in translation and implementation of science and strategy. Slide, please. Thank you for your kind attention.
Great. Thank you so much, Bang. That was really interesting to hear from the education perspective. And I'm looking forward to asking you some questions towards the end. So now, next speaker, I want to introduce Clotilda Andienza. And Clotilda is coordinator for the Centre for Development. So I'm really interested to hear what you have to present, Clotilda. Over to you. Thank you.
Hello? Hello?
Yes, we can hear you.
Can you hear me?
Yes, we can.
Yeah, because I have a terrible storm here and okay. And the internet is really terrible. I hope you to get me.
Yeah,
so
we're
my
getting
name
you.
is Clotilda. Okay. My name is Clotilda Andienza, and I am the CEO of the Center for Advocacy in Gender Equality and Action for Development, CAGET. I'm a woman peace builder, and I represent the Southwest Northwest Women's Task Force for Peace in Cameroon and the National Women's Platform for Peace Building. I'm particularly interested in this webinar because it's been a passion for me to see how we can combine what we are doing in the field with research approaches in order to better effect the results that we are struggling to achieve in Cameroon, especially as we are living in a conflict right now. So my presentation to you will be on looking at the gaps and enhancing capacities for the evidence synthesis in peace building. So before I move ahead, I want to say that peace building is a very complicated issue. And every place, every city is different. In the field, we don't share what we know, do things the same as everybody, help build lasting peace. And gaps in evidence synthesis also do limit our ability to learn and adapt. Evidence synthesis, therefore, in peace building is a process of systematically collecting, analyzing, and integrating findings from multiple studies or sources to understand what works for whom, under what conditions. Yeah. And so our goal will be to strengthen systems for gathering and using evidence in peace building, including audit and feedback. Next. Next slide. So let us look at what is the current situation. The current situation presents gaps of evidence synthesis in peace building. And this can be analyzed in three different directions. We have the technical gaps, we have the engagement gaps, and we have the resource gaps. Under the technical gaps, we see there is limited expertise in synthesis methods, lack of access to database and search tools. Under engagement gaps, there is poor collaboration between stakeholders, and there is low involvement of local communities in research. And under resource gaps, we see that there is inadequate funding for evidence synthesis work, few trained experts in research and synthesis method, especially when it comes to peace building, limited access to journals, studies, and the reliable data, and the competing priorities that push evidence use aside. Next slide, please. So what are the consequences of these gaps in peace building? We see that although we do a lot of work in diverse fields, different people intervening at different areas with different strategies, there is inefficient peace building activities. There is poor decision making, and there is misallocation of resources, as well as we continue having prolonged conflicts and instability like what we have in Cameroon. Slide, please. So what is the importance of evidence synthesis? Why evidence synthesis in peace building? We believe that it will inform decision making with reliable data. It will improve peace building effectiveness, and it will enhance accountability as well as promote long-lasting peace. Next slide, please. Did you go behind or what? So there is need for capacity building as a necessity. If peace builders on the ground have to be effective in analyzing data, or if they have to be involved in systematic reviews, looking at different studies in order to come out with the best, then there is need for capacity building. There's need to upskill local actors in synthesis methods, improve access to database and digital tools, and boost stakeholder engagement, as well as upgrade the infrastructure. The benefits of capacity building will include efficient data-driven peace building and improved decision-making and accountability, and therefore ensuring sustained peace outcomes. Slide, please. Now, can you hear me?
Yes.
Okay, sorry. So we're looking at proposed solutions. So we want to propose solutions in according to phases, from phase 1, 2, 3. So we think that in the first phase, there could be a training, which will have to take into consideration methods, tools, and best practices. And then in the second phase, we'll look at infrastructure that has to do with resources, database, and the various platforms. And in the third phase will be engagement with networks and stakeholders. And then finally, we'll have key stakeholders, which is the local government, the NGOs, and the researchers. Next, please. Slide. Is need to conduct needs assessment, roll out training and mentoring, and set up infrastructure, as well as ongoing monitoring. Then under monitoring and evaluation, we'll be able to track progress of interventions, identify areas for improvement, and ensure transparency and accountability. Next. So for sustainability, which will have to do with ensuring the long-term impact, we think that institutionalization of evidence synthesis practices will be recommended, and that there is need to build local ownership and leadership, mobilize sustainable funding sources, and then do strategic partnerships, which will involve collaborate with regional and global actors and facilitate knowledge sharing and support. And then look at different funding mechanisms, including securing funding for capacity building and developing long-term financial strategies. Next. Now, we want to do a call for action, and our final thoughts. So we believe that we have been doing a lot of peace building, but there has been the lack of audit and feedback. And so we want to recommend that there is the need for the integration of audit and feedback into peace building, because this is going to go a long way to ensure that different results, different strategies, different approaches can be examined and decisions can be made both at the level of the communities, the stakeholders, and at the level of the government that will be informed by this, and that the audit and feedback practices or processes will equally have a very effective effect on this. And so I would like to leave by saying a peaceful society requires an effectively functioning evidence-based decision-making system. Thank you very much. I hope the rain allowed people to hear me, because we're actually on the way under a storm.
Yeah, we heard you, Lara. Thank you.
Thank God.
Thank you, Clotilda. That was really, really interesting. And I'm glad you got through your presentation, given the challenges. So thank you so much. Okay, before we just go on to our final speaker, if you do have any questions or comments, please put them into the chat so that that we can see them for the final wrap-up part. So our next presenter is Bide Yong, who's a health advisor and program manager at eBase Africa. So over to you, Bide. You're just on mute.
Sorry, let me change.
Yep, that's
So,
right.
yeah, thank you very much, Alex. I want to thank the previous presenters, and I want to talk a little on reflection on innovation and the cross-cutting, cross-sector potential. From what Thelma, Tatiana, and Claudia have presented, we actually see that audit and feedback is actually working. And why audit and feedback innovative? We see that JBI audit and feedback approach is a powerful, low-cost strategy because it is using existing system to create meaningful change. You don't need to go somewhere to look for a change, to look for what to implement. It also adapts flexible across sectors and settings. We see that it can be used. It has been used in health. We are using it in education, and it can be used in peace building. So it crosses. It adapts flexible across sectors and settings. We also see that it embeds learning and local ownership through structured reflection and action, and the audience relevant and sustainable. Why? Because we don't invent solutions in the air. We discuss the solution with the stakeholders. It's the multidisciplinary team that sit down together and discuss solutions and come up with a work plan on how to realize this solution. We also see that there's a proven cross-sector impact on audit and feedback. We have seen in health how it improved malaria diagnosis and treatment. We've also seen how it increased vaccine uptake through better healthcare provider communication. And we also saw how this audit and feedback from Thelma's presentation, how it also improved health worker resilience to COVID-19. And it also in education, we've seen how audit and feedback strengthen teachers' performance and classroom practices. And this help improvement in the children's attainment, performance attainment. In peace building, as Madame Clotilde just presented, we have seen that it laid a groundwork for inclusive, evidence-based intervention for impact for conflict resolution. So what does this mean for stakeholders? For government and the donors, we think that audit and feedback is scalable and cost-effective. That's what we are thinking. Then also, we also think that it promotes transparency and systemic improvement. For communities, we think that audit and feedback, your voices is essential to shaping and sustaining impact. And audit and feedback ensures intervention reflect real world needs. What are the next step then? We also want to call on the collaborative across sectors and region. We also want to talk of scale approach that work. In fact, we have seen all the approaches that in the evidence, and we are seeing that we should learn and to scale approaches that work, and we should invest in culture of evidence-informed improvement to strengthen systems. Thank you very much. That is what I have to say about the reflection on innovation and the cross-sector potential. Thank you.
Great, thank you so much, Bide, for really summing up from the three other presenters around the cross-sector potential for audit and feedback. And so that was really interesting to hear. I am very conscious of our time disappearing, and I know that you've just had an hour set aside, but I would just like to ask, I guess, one question, and if anybody, I can't see any questions in the chat there, but if anybody did have any questions that they did want to add. So Patrick says we're not reinventing the wheel, we're making it roll further across health, education, and now peace building, or from Andrea Ilanja. So yeah, that's very, very true. And I think that's really important. And at JBI, I mean, we've been working in this evidence implementation or audit and feedback sector for over 20 years now, but really just within the health area. And it's really exciting to see here through the connections through eBase that you're able to be touching on healthcare and into education, and now also into this peace building sector using the audit and feedback approach. And I know from the work that we do at JBI, the people keep coming back to us and saying it's not just about doing data collection, because people have often been involved in doing data collection, but not actually really understanding the results or understanding the evidence that informs those results. So I think the fact that you can engage with your key stakeholders, you can involve the staff or the teachers, the healthcare workers, you know, your clients and your patients is so important, and to help them to understand is so important. And I think that's really where ABI, you know, to be able to use this approach across these different sectors is so important. So I really would want to encourage you, and I think from a JBI perspective, obviously, we're really excited. We're really thrilled to see you using the evidence implementation and the audit and feedback approach, using evidence, helping people to understand evidence. And I think if you can build the capacity of people in understanding the evidence for their context, that will really help to drive the audit and feedback and to really drive some key results there. I just want to open it up if there's any other comments that anybody else wants to make. No? Okay. Well, thank you so much for your time today. I have been informed that there is the webinar 2 is next Thursday, I believe, at the same time. Correct me if I'm wrong with that. And I wish you all the very best with these webinar series. It's fantastic to see you engaging in this way together. yeah, I don't know if anybody, Patrick, do you want to finish off with anything?
Thanks very much, Alexa. It's really great to have you on this webinar. And I really told my team when I learned that you will be joining us that this is very exciting. And as you can see, and again, I will go back to the words that Andrea said, that we are not reinventing the wheel. We're just making the wheel to go further into other sectors. And I think that's what we need at this time when we are thinking from a holistic perspective of the sustainable development goals. And you see, for example, we've been talking with Clotilda about peace building and how we can use it in this space. And it's something we are still grappling with. But I believe that just like we moved on to education, we are going to be able to find a way with peace building. With education, you will notice that all the projects that were done had so many audit criteria because it's very difficult to identify key points in a classroom. There are lots of things that a teacher has to do at the same time. But I think this reinforces the fact that evidence is maybe even needed more in education than in health. And maybe we'll find similar challenges in peace building. So it's an exciting journey, and we are happy to roll along with the capacities we've gained from JBI. Thank you.
Great. And I look forward to hearing more, hopefully hearing more, seeing the stories that get told or at conferences and whatever. But all the best with that work, and certainly let us know however we can assist in any way. So lovely to meet you all, and all the best. Thanks, everybody.
Thank you.
Thank you.